Hello, my name is Dr Anne Robinson and I'm Associate Medical Director for Patient Safety. Here at Warrington and Halton Hospitals, we believe that patient safety should always be at the forefront of the care that we deliver. In 2015, NHS England introduced a national set of safety standards for invasive procedures, otherwise known as LocSSIPS. It is intended that these be modified to produce local safety standards for invasive procedures, otherwise known as LocSSIPS. NatSIPS were created to bring together national and local learning from previous never events, serious incidents and near misses in order to provide NHS trusts with a set of recommendations to provide safer care for patients. At Warrington and Halton Hospitals we've had a series of never events in recent years, and during 2018 and 19 it's one of our top quality priorities to introduce the national safety standards for invasive procedures. The idea is that your local safety checklist is easy to use, provides consistency within your multidisciplinary team, allowing staff to raise concerns about patient safety.
Come in.
Hi Bob, my name's
hi,
Carol.
Kristen.
I'm the ward manager and this is Holly, she's
Hi.
the ward sister. Good morning. Dr Tanner's asked us this morning to insert a nasogastric tube.
Yeah.
The reason being is for nutrition.
Yeah, that's right. I'm going to get some food there, want
Absolutely. So while Holly's washing her hands, I'll just go through a few things with you. Is that okay? Do you have any questions? What we're going to do now is I'm going to go through a checklist that we use and ask you a couple of questions, but I'll also talk to Holly as we go through. Can I just check some details with you? Is that okay?
Yeah,
Bob?
certainly, sister.
Okay, so it's Robert Grimsdale and your date of birth is?
15766.
Okay, and your unit number is W012345.
But please call me Bob.
Thank you. Okay, so I'm going to run through the rest of the checklist
sure.
now. Okay, so you're happy for us to go through the procedure?
Yeah.
Okay, and we just need to check now if we've got the right size for the nasogastric tube, okay?
Yeah. Okay, no worries.
Okay, Bob, could you just come forward for me while I get you in the right position? Could you just bring yourself back a little bit in the bed?
Yeah.
Okay, thank you.
Okay, so I'm just going to measure up against
Okay.
you here. So get okay, about 70 centimetres.
Let's make sure we have all the equipment.
Yeah.
So we have the NG tube and not a Riles tube.
NG tube, not the Riles.
Okay, and we have the sticky tape for the nose and lubricating jelly.
Yeah.
Okay, so time out before we start the procedure. Can we just confirm there's no base of skull fracture?
Nope.
And pre-measurement of the length of the NG tube
It's
is?
about 70 centimetres.
Okay. Is position optimal?
Yeah, we've just repositioned him now.
Okay. And we both understand our role?
Yeah.
Okay, any concerns about the procedure?
Not from me.
Bob, any concerns about the procedure? No further concerns? Okay.
Is it supposed to be this uncomfortable?
Just while the guard wire's in.
And when does the guy wire come out?
Once it's x-rayed and the doctors have confirmed it's in the right place.
So now the nasogastric tube is being inserted. Is there any equipment issues?
No.
Has the chest x-ray been requested?
Not yet, I'll just get Dr. Inskip when we come out to order it.
Have we aspirated, and is the aspirate below pH of 5.5?
Not yet, just need to aspirate now. Okay, Bob, we're just going to get some aspirate off the end of this NG tube so we can just check if it's in the right place. Okay, this won't hurt. There we go. Just check the pH of that.
Okay.
And check the positioning.
Can we just confirm the aspirate is below 5.5?
Yeah, it's 2.5.
Thank you. Okay, Bob, you did really well
Thank
there.
you.
The procedure's now completed.
Okay.
Okay, thank
All
you.
right. Thank
So tubes in situ, I'll just go and get Dr. Inskip to order an x-ray, check x-ray to confirm position. Dr. Inskip, hi, we've just inserted an NG tube. Would you be able to order an x-ray for us, please?
Fine. Okay, that's booked.
Would you be able to confirm once the x-ray is done whether the NG is in the right place so that we can remove the guide wire?
Yeah, that's fine. I'll
Commence
come and let you
video.
know.
Thank you.
Okay, I'm coming this way. So my name's Suzanne, I'm one of the radiographers. Okay. Can I just confirm your name, date of birth? Lovely, that's great. So I'm just going to bring you around this way now. Just get you to have a seat on our table here and then pass you over to Dr. Williams. He'll just have a chat with you.
Okay. So my name's Dr. Williams, I'm one of the consultants here. It's going to be me with this procedure for you today. So before we start, I'll just make sure we've got the right person.
Yeah, that's right.
So, and today we're going to do this hydrodilatation procedure, and it's your left shoulder.
Yeah.
Okay, so I noticed you've had one before, but I'll explain what we do just for completeness. So any questions you want to ask?
No.
Okay, so it just takes us a few minutes to get set up, and then we'll get started.
Thank you.
Okay, so we're just going to go through the checklist. So we've all introduced ourselves. Andrew has confirmed his identity, and we've also confirmed that it's the left shoulder, and you're happy for us to proceed. Yeah. Do you have any allergies that you're aware of?
Allergic to penicillin.
Penicillin, okay. Let's just make a note of that. Okay, and all our equipment is available and in date. We'll obviously double check that in a moment when we've set everything up, and we'll check all the medicines at the time. Okay, you can
Okay,
get
so I'm
ready.
just going to wash my hands, put my lead apron on, and we'll get started.
There we go, and then we'll just get you to lie down. Now, are you warm enough or do you want a blanket while you're here? Okay. I'm just going to pop these in. Okay, so we'll just pop that in this side as well. There you go. Okay, so if you rest your arms down now, comfortable. That's lidocaine 1%.
Yep.
Expiry 2020. Same again. Okay, so just to finish the first part of the checklist, we've checked all the medicines for strength and expiry date.
Correct.
Any complications or deviations from our normal procedure?
No,
No. Okay, and have you reviewed previous imaging?
that's not applicable.
Okay.
Okay, so we've finished setting up all the equipment now, but we're just going to take a little pause just to go through our checklist one more time, just to make sure we've got everything correct.
We're just going to confirm our patient is Andrew. Correct patient is selected on our work list. We're injecting left shoulder. All regulations are met. Have you got any final questions or concerns, Andrew, before we start?
No.
No. Okay. We're all happy to proceed?
Yes?
Yes.
Yeah.
Okay, so we're all finished, so I'm just going to get rid of all the sharps, and then we'll sit you up, make sure you feel okay, and you'll be able to get dressed and go.
Okay, thank
Just there for a couple of minutes. Okay, so the sharps box.
Okay, Andrew, so we'll just sit you up. You okay there? That's it, just swing your legs around. Okay, so we're just going to do our sign out. So have all pieces of invasive equipment been accounted for?
Yes.
Yeah, there were 4 sharps there, all in the bin. All the medicines are there ready to be recorded. You've given post-procedural care to the patient.
Yes.
Have you got any final concerns or questions?
No.
Thank you for watching. I hope this short video helps you to develop and introduce local safety standards for invasive procedures in your own area of work. Good luck!